Hello and welcome to yet another episode of the In-News series. My name is Pooja Dwivedi. Today we are going to discuss the protests against the Right to Health Act by the doctors of Rajasthan. The Indian Medical Association has also extended its support to the doctors of Rajasthan, but the services that are related to health have come to a standstill in Rajasthan. What is the matter? Why are there protests against this particular act? We are going to discuss everything today. From the perspective of GS Mains paper 2nd and 4th, it is important that we look at these subtopics to understand the particular issue more precisely. The Right to Health Bill has been passed last week and the doctors are protesting against it. They have hit the healthcare services across the state of Rajasthan. IMA has announced its support for the Rajasthan doctors and the bill was passed in the state assembly last week itself. Now the problem, we are going to discuss that, but let's talk about the intricate features of this particular bill. Every resident has the right to avail free of cost treatment along with emergency treatment. The issue is that this particular treatment, what is emergency treatment, has not been defined. Now, this emergency treatment would be provided without any prepayment. Okay, this is one of the issues that the doctors are protesting against because, of course, they need funds to run their hospital. So, without any prepayment at the health institution in the state, any person is okay. It's okay for him or her to get a emergency treatment. Neither government nor private hospitals nor doctors can refuse such kind of treatment to the person who is seeking emergency treatment. And it provides for residents of Rajasthan to avail free health services in any clinical establishment. Now, any person in the state can avail free outdoor and indoor patient department service, consultation, medicine and diagnostics in public health institution, emergency treatment and care at all healthcare providers without prepayment, and access to referral transport by healthcare establishments as well. Other than that, they can also avail free transportation, free treatment, free insurance coverage against road accidents at all healthcare establishment too. Now, the protest ranges for many matters. Let us talk about them step by step. First is that the bill doesn't help patients much, but penalizes doctors. Although the availability has been provided free of cost for most of the things for the residents of Rajasthan, but the problem is with that the doctors must offer emergency treatment without any prepayment. This is in violation to Article 19, Clause 1, Subclause G, that who is eventually going to pay for whatever treatment has been availed by the patients. Health is although a right of every citizen under Article 21, but providing for it is the responsibility of the government. So, there has not been any sort of clause that shows that this particular treatment will be provided, the reimbursement will be provided by the government. The Act doesn't mention that the government will reimburse the hospital, and there is also no clarity on how or when these funds will come. So, without any clarity, of course, it is a little frightening for the doctors. Redressal mechanism which has been mentioned in the bill will not let the doctors work in peace. How? See, there is still some confusion among a section of doctors who are citing that the old bill was sent to the select committee and there has not been any sort of definition of emergency. It has been set in the bill that the state health authority will decide what an emergency treatment should be. It doesn't define a clear mechanism of reimbursement and doesn't say who should treat what, which doctor should treat what. Now, this is also a problem according to the doctors. Local politicians and government's nominated member would be part of district authority to look into patients' complaint. So, there was a problem with this also, that doctors should also be there. What does a politician have to do with it? Although the change was done in the bill, and two nominated members of the government with two IMA, Indian Medical Association member in the state health authority, and the district health authorities were also included. And now many, public policy makers say that this is a step in the right direction. Let's see how. There is a demand to roll back the bill, but it is for the good of the patients. It is like throwing the baby along with the bath water. So 95% of this bill talks about making the government healthcare system accountable. The policy has been made in this particular bill in such a manner that the government will be able to pinpoint where the problem actually lies. And the section on all hospitals are being asked to provide emergency accounts for only 5% of the bill. And it has been blown out of proportion, this has been said by the public policy makers. Private hospitals do have some responsibility towards people because most of their public as well as private, most of their whatever benefits that they are getting, this basic structure they are getting, it is with the help of taxpayers' money. Doctors' education has been subsidized by taxpayers. Sometimes the land for hospital is subsidized by the government. So it is kind of a return for that. Now, there are many other subsidies for them. This is also one of the reasons that public policy makers are saying that it should not be blown out of proportion. A 1996 Supreme Court judgment has made it mandatory for all medical practitioners to provide emergency care, right to life it is under. So how is it a problem now? It's not clear. Now in 2018 as well, the National Commission on Human Rights drafted a Charter of Patients' Rights to be implemented by the state government. Rajasthan has also other schemes which manifest its right to health policies, such as Mukhyamantri Chiranjeevi Swasthya Bima Yojana. The health coverage is provided in over 1,550 public as well as private hospitals across the state. Under the Yojana, insurance coverage is also provided for certain types of treatments. Moving ahead. Now, Delhi also has a scheme which can be seen as an alternative for Rajasthan if supposedly the government rolls back the bill. Delhi has a scheme under which all hospitals are reimbursed for emergency treatment. So, it is important for funding as well. They provide for road traffic accidents, emergency treatments are like for this, fires, acid attacks within the territory of Delhi. All stakeholders were brought on board before rolling out this bill. So, the policymakers are unable to understand that why is it such a problem now. The rates were determined lower at first and then at par with the Ayushman Bharat Yojana with added incentives for hospitals which have been accredited with National Accreditation Board for Hospitals and Healthcare Providers, and hospitals asked to not charge the patients anything. So this is the entire issue that we had to cover. I hope you understood this topic. That's it. Thank you so much for watching.